society thanks to the film and movies. And since then, the advancement of technology, there has been many modifications in the techniques of ECT administration. For example, like we give ECT now under general anesthesia, the stimulus intensity, the type of pulse, the type of current we use, and these all have led to a better tolerability and better acceptability of ECT despite the stigma in our society. And also, these modifications have led to decline in the likelihood of the cognitive impairment we see in patients having ECT, which is reported by patients of ECT. So, in patients who have failed to respond to pharmacotherapy, that is the refractory cases, or they have adverse reactions to pharmacotherapy, ECT is a very good mode of treatment as it itself is not associated with any significant side effects, except the reports of the amnesia, which I just mentioned about, which has also decreased because of the newer modifications in ECT. Now, ECT is also, it is rather used for the treatment of various antipsychotic induced side effects like the neuroleptic malignant syndrome, which is caused by antipsychotics. Also in high risk groups, we all know children, adolescents, and elderly and pregnant females who are very sensitive to the neuroleptics. ECT is a very safer option. In major depressive disorder, we all know ECT is the most effective treatment currently available, and no treatment has ever found to be superior to ECT in treatment of depression in a controlled trial. Also, in patients presenting to the department with grave functional impairment, suicidality, aggression, risk of harm to others, risk of harm to self, not responding to initially medications, ECT provides rapid relief even just after 1 to 2 sessions. And it has also been seen that the sensitivity to drugs improve after ECT. In comorbid cases like comorbid epilepsies, it increases the seizure threshold, and hence the frequency of the seizure also increases. Also, these days, maintenance ECTs are also given. They have also come into the picture, which are known to prevent relapses and enhance remission in the patients. Hence, MECTs are also being given on an OPD basis nowadays. And in the West, what is being... Thank you. 3 minutes.
Good afternoon, everyone. I'm going to speak against the motion. So, as a PG resident, when I'm given the task to explain the process of ECT, which involves an electric charge being passed through the brain, this description itself is very frightening. So, it is definitely very difficult and painful for the caregivers of a patient who is already suffering to agree to such a procedure. Although over the years we have shifted to to modified ECT, which involves the use of anesthesia, but it has also added to the side effect, the cost and the risk of ECT procedure. ECT is associated with many physiological changes, which may cause pulmonary edema or myocardial infarction, and in some cases, in very rare cases, cardiac shock also. An extreme increase in cerebral blood flow due to sympathetic stimulation can lead to intracranial hemorrhages. Neuromuscular blocking agents may cause pulmonary aspirations and respiratory failure. Succinylcholine-related myalgia is as common as nausea associated with anesthetic drugs such as sevoflurane and etomidate. A comprehensive review of ECT by Red and Bentel in 2010 has presented a strong evidence of persistent and permanent brain dysfunction in around 12 to 55% of patients as a direct result of treatment. So ECT is not only ECT does not have the medical side effect, not only the medical side effect, but also the economical burden, as it adds up to the anesthesia cost, hospital stay expenses, daily wage loss to the people, conveyance cost to the people who are coming for maintenance ECTs. In the same review by Red and Pentol in 2010, they also determined that the cost-benefit analysis of ECT is so poor that its use cannot be scientifically justified. So the current scenario of evidence-based treatment requires a risk-benefit analysis for any treatment. However, in case of ECT, there are only 11 case control studies which are mostly done after 1986. These studies, mostly they have a very small sample size and were methodologically flawed. So no study have found any evidence that ECT is better than placebo beyond the end of treatment. However, all meta-analysis relying on these studies have somehow concluded that ECT is more effective than placebo purely on the basis of temporary gains. Despite lack of evidence, psychiatry remains so adamant that ECT works that no studies to establish the efficacy has been done after 1986. Instead, many studies investigated which kind of ECT can cause least damage. Hence, with this, I would like to conclude my argument against the use of ECT.
So, co as my co-PG mentioned about the efficacy of ECT, that no studies have been seen since 1986 regarding the efficacy of ECT. So, like, what would be your take on that? And also, you mentioned about the risk-benefit analysis of ECT, that it is not like it has not shown to be better than placebo. But we have, like, we on a daily basis, and many studies which I have gone through have shown that ECT in patients with like who are come with grave functional impairment, suicidality, major depressive disorders, they basically change the lives of people. So what would you like to say on that?
So it is beneficial, but only up till the treatment is done. After that point of time, in those studies also they have mentioned that the symptoms reappeared. For the cost benefit analysis that we say, the ECT it adds up to a lot of cost, like the anesthesia and also the conveyance charges. So it is not you cannot give a ECT on a OPD basis. I have not seen a lot of people getting ECT on a OPD basis, because the people need to get anesthetic checkup done and all the related investigations. So it definitely adds up to the cost, and the results are not sustained.
She mentioned
Do I need to बोल?
नहीं मैं normally
मतलब मैं जैसे like she said
question पूछ लिया rebuttal में question कभी पूछते हैं कि आपको उसके बाद भी टाइम मिलता है क्वेश्चन जैसे हम जैसे rebuttal को पूछते rebuttal के बाद एंड में हमें और या कैसे क्वेश्चन पूछा होगा बट वो तो चलो हम कर लेंगे बट rebuttal अलग अलग क्वेश्चन अलग ठीक है तो कुछ क्वेश्चन दिख
like she has mentioned that most of the studies they mention the efficacy. Most of the studies that have been done, they are not case control. Mostly they are they are checking the efficacy, but not in comparison to the placebo. So you do not know if it is actual effect or a placebo effect.